Now, before we move on, it is about organization. First, that you set up, then you memorize. In that way, you have created containers of compartments in which you can then fill it up with details. Okay, but first, take a look at the selection of the outline here. Important growth factors. Think about where you are. Close your eyes, conceptualize. These are growth factors that are going to work in excess. And when they do, they are going to then stimulate the receptor in excess. You are going to have increased the signal transduction done to the nucleus and obviously may result in increased growth. The first growth that you will be responsible for is called a FGF, a fibroblast growth factor, and this might be associated with HST1 that you will have to memorize. And brings us to stomach cancer. INT2 is a FGF, fibroblast growth factors. Another detail, and this could be associated with many types of cancers, and the big one that you definitely want to know is this one, a growth factor at PDGF associated with SIS. And the type of cancer this is associated with will be a gliomas. In other words, astrocytoma. When we talk about neuropathology and astrocytoma, there will be two major astrocytomas that you will be responsible for. One, in fact, will be glioblastoma multiforme, the other one being polycystic type of neuroglioma. Our next category would be what does the growth factor bind to? A receptor. So there are receptors that have now become independent autonomous of any control whatsoever. Now these receptors are working in great excess or in greater stimulation. And now you can imagine the autonomous receptor activity that there will be increased the signal transduction done to the nucleus. Our big one here will be ERBB1 and ERBB2. ERBB1 and ERBB2. ERBB1, well, we have epidermal growth factor receptor, and ERBB1 is specific for squamous cell cancer of the lung, and that you have to know. Then we have ERBB2. How many breasts do you have? 2. The other name for this is also HER2-neu. This is the epidermal growth factor receptor that you want to know, and it is associated its association with breast cancer more so. You have two major epidermal growth factor receptors, ERBB1 and ERBB2. Make sure you know about lung and breast respectively. Then you have another growth factor receptor, and this is RET. Now with RET, it is a glial-neurotrophic factor receptor. Glial. RET is associated with medullary cancer of the thyroid, well found often with MEN 2A and 2B. Oncogenes. And now signal transduction, we have T922 being our second major translocation in this topic. And with T922, you must know that it is a BCR-ABL fusion protein. Memorize that. Don't get a BCR confused with BCL2. Students often do that. Do not do it anymore with T922. I told you, apart from CML, chronic myelogenous leukemia, where the median age for this would be 40s, or ALL, acute lymphoblastic leukemia, the most common cause of leukemia in a child, both associated with Philadelphia chromosome BCR AABL. This term codes for good RTK, or in other words, non-receptor tyrosine kinase. At least note operative and word TK, tyrosine kinase. KRAS, really the foundation here is RAS. I have mentioned this field a few times, I promise. I will go into detail. We have to. RAS is coupled with. I asked you kindly to memorize RIS. RAS is committed to word GTP. Once again, RAS associated with GTP for henceforth if you want. You wanted to pronounce or spell pancreas as pancreas if that helps you, but we have pancreas and we have the colon being two major cancers with KRAS. You can have other RAS as well, including HRAS and also NRAS, and as we continue through our course in pathology, I will tell you where HRAS is associated with, and NRAS is already dealing with our M as in neuro. Here, we will take a look at the nuclear reactors. We are done in the nucleus. We have C-MYC, and these are working with the nucleus, bringing about a Burkitt lymphoma. L as in L-MYC would be for lung, and more so with small lung cancer. And then N as in neuroblastoma. Take a look at what happened here. We have M-MYC, and this is them being placed next to this HSR. And this region that M-MYC might be associated next to would be cause gene amplification, and that you have to know. So take a look at M-MYC and next to HSR, then cause major gene amplification. Our next topic takes us into cell cycle regulator. Within the cell cycle regulator, I will focus upon cyclin D as being a separate topic. I have two, but anytime that you see cyclin D, these are within the cell, and within the cell cycle, we will talk about further with tumor suppressor genes. And I will walk you through in great detail and exact mechanisms as to how cyclin D is going to promote a cell to be or remain within a cell cycle forever more. And the cyclin D positive to you at least. Memories, mantle cell lymphoma, and this translocation here would be T1114. What's that chromosome 14 represent to you? It represents immunoglobulin heavy chain.